Hello friends, welcome to the image 8.44 veins, meninges and dural venous sinuses in the images section for PG entrance examination. So this is the dura mater, right? These are the different sinuses which you can see. First we have superior sagittal sinus. This sinus which you can see here is called as superior sagittal sinus, which is located in this is the falx cerebri. Okay, this is the falx cerebri. Superior border of the falx cerebri, you can see this superior sagittal sinus. This superior sagittal sinus receives superior cerebral veins, diploic, emissary veins and CSF. Whereas inferior, this is the falx cerebri. Inferior margin of the falx cerebri contains inferior sagittal sinus. Into this inferior sagittal sinus, few cerebral veins and veins from the falx cerebri will drain into this inferior sagittal sinus. Then we have straight sinus. This straight sinus is present here at the junction of the falx cerebri and the tentorum cerebelli. This is tentorum cerebelli. Falx cerebri and tentorum cerebelli, at this junction we have this sinus which you can see here. This is called as straight sinus. Into this straight sinus, the inferior sagittal sinus, great cerebral veins, posterior cerebral veins, posterior cerebral veins, superior cerebellar veins and veins from the falx cerebri drain into this straight sinus. Then we also have one more sinus which is called as occipital sinus. We cannot see this occipital sinus in this image, though this occipital sinus is present in the falx cerebelli, in the occipital, against the occipital bone. It communicates inferiorly with vertebral plexus of veins. Then we have this transverse sinus. Transverse sinus is right transverse sinus and left transverse sinus. This transverse sinus receives the blood supply from the confluence of sinuses. Confluence of sinuses is a dilated space where the superior sagittal sinus, this is the confluence of sinuses, where the superior sagittal sinus, then the transverse straight sinus, superior sagittal sinus, straight sinus and occipital sinus drain into this confluence of sinus. The transverse sinus receives blood supply from this confluence of sinuses. That is, right receives blood supply either from transverse or usually superior sagittal sinus, whereas the left transverse sinus receives blood supply from the transverse sinus and usually the straight sinus. And sometimes this transverse sinus also receives blood supply from, also receives drainage from superior petrosal sinus, inferior cerebral, cerebellar, diploic and emissary veins. Then we have these sigmoid sinus. These sigmoid sinus are the continuation of transverse sinus, is called as sigmoid sinus. This sigmoid sinus receives blood from transverse sinus, some cerebellar, cerebral, diploic and emissary veins. Then we have cavernous sinus. This cavernous sinus receives blood from cerebral, ophthalmic, sphenoparietal and emissary veins. Then you can also see inferior petrosal sinus. Inferior petrosal sinus receives from cavernous sinus and cerebellar veins. We also have superior petrosal sinus, which will also receive from the cavernous sinus. Cavernous sinus gives its blood to inferior petrosal sinus inferiorly and superior petrosal sinus superiorly. Okay. So we also have basilar sinus. This basilar sinus is the clivus, is present at the clivus, and this basilar sinus will connect the bilateral, this is inferior petrosal sinus. Both the inferior petrosal sinuses are communicated along with the vertebral plexus of veins through this basilar sinuses. This is about the dural venous sinuses. Thank you for watching my lecture. Thank you.